Sure, so we can start.
The speakers have come.
Yeah, so we have Dr. Kapil Yadav and Dr. Vicky Das, and the rest are joining.
Okay. Good afternoon and welcome to the 23rd episode of Healthy Samvad or Heal Thy Samvad, hosted by Heal Foundation in association with Heal Health and supported by HemoQ. I am Shankar Raj, President of Heal Foundation. Today's Samvad is on quality, accessibility, and data integration, keys to anemia eradication. Moderating this session would be Dr. Shivakumar, Advisor, ESI MedTech Solutions. There would be 3 sessions comprising key and well-experienced speakers, and each session would be of 30 minutes, except for the first session, which would be 35 because we have 4 speakers. And we are live on YouTube. Anybody wanting to ask questions, the chat box is open and you can ask in the chat box. 5 minutes before the session is to be over, there would be a bell. So that would be a warning that the session is supposed to end in 5 minutes. The first session is on best quality assessment, gaps, and solutions. For this session, we have with us Dr. Kapil Yadav, who is currently serving as Additional Professor, Center for Community Medicine, and Nodal Officer for National Health and of Excellence and Advanced Research on Anemia Control at AIIMS, New Delhi. With over 90 research publications, he was awarded the Sri R.N. Roy Award for Best Original Research Article by Indian Public Awareness. We also have with us Dr. Archana Mishra, who will be joining us. She serves as the Deputy Director, Maternal Health in National Health Mission, Government of Madhya Pradesh. She has contributed as an expert in various national level committees like the IPHS and various others. She was awarded for innovation at National Health Summit for best practices for consecutive 5 years. The next speaker is Dr. V.K. Das, who serves as Director, Medical and Health Services, Dadra and Nagar Haveli, Daman and Diu. He has over 30 years of experience in medical field and holds a degree in MBA in hospital management and pharmaceutical marketing. Last but not least is got Dr. Gautam K.R. Singh, is currently serving as SPO, Adolescent Health, Rashtriya Kishore Swasthya Karyakram, and State Nodal Officer, Anemia Mukt Bharat, at Directorate of Family Welfare, Government of National Capital Territory of Delhi. Over to you, Dr. Shivkumar. Please unmute, Dr. Shivkumar, please unmute. Please.
Yeah. Good afternoon to all of you. Thank you, Mr. Shankar, and it is my pleasure to be moderating this session today afternoon. Without much delay, I would like to go directly to the first session. As you have said that, we have 4 participants, eminent personalities, Dr. Kapil Yadav, Dr. V.K. Das, Dr. Archana, and Dr. Gautam Kumar Singh. The first session is on best quality assessment, gaps, and solutions. Okay, before going into the session, I thought I would, for the benefit of the audience overall, I thought I will talk about Anemia Mukt Bharat for 30 seconds. Anemia Mukt Bharat was launched in 2018 to reduce the anemia overall in India. And it's an initiative of Ministry of Health and Family Welfare and United Nations Children's Education Fund, UNICEF. The scheme is part of Intensified National Iron Plus Initiative Program and comes from Prime Minister's overreaching scheme of historical nutritional nourishment. That is the Poshan Abhiyan. As you're all aware, it focuses on 6 target beneficiary groups through 6 interventions and 6 institutional mechanisms to achieve the envisaged target under the Poshan Abhiyan. It was launched to speed up the process in the reduction of anemia during the period of 2005 to 2005, the reduction in anemia was less than 1%. So there is a focus on aggressively reducing the anemia and meet the overall goals. So my first question to Dr. Kapil Yadav, who is a faculty member of community medicine at All India Institute of Medical Sciences. Dr. Yadav, Anemia Mukt Bharat is implemented by the ministry under Government of India using the 6x6x6 strategy, which includes 6 beneficiaries, 6 interventions, and 6 institutional mechanisms. According to you, how effectively this strategy has percolated down to the states and union territories, and how it is being implemented, coming from a mega institute like AIMS and overseeing this program. It would be great to hear from you on this. Over to you, Dr. Yadav.
Thank you, Dr. Shiva Kumar. I think it's an excellent question, and we all should be aware that it's a public health program. It was launched by Honorable Prime Minister on 14th of April 2018. And Anemia Mukt Bharat, as you outlined, has 6 strategies, mechanisms, and interventions.
Dr. Yadav, I think audio is little feeble. Can you be a little closer to the mic, sir, if you don't mind?
Now it's better?
Yeah, definitely better. Yeah.
So primarily, it has been only early years of launch of this program. So we have been very successful in few of the intervention strategies, especially if you look at the provision of diagnosis across various states. And as borne out by recent NSHS surveys, the IFA coverage was one of the interventions has also increased significantly across states. But at the same time, there has been some challenges also, and especially non-nutritional causes of anemia. Those are the interventions that still needs to be further augmented. And I think most of the states have successfully launched Anemia Mukt Bharat. They've had the initial meetings. Trainings have been undertaken in various states. And we have a long way to go if we have to achieve the milestones that have been laid out in this program. Because the challenge is humongous. You see, more or less 50% of our population suffers from anemia. And another 50% who does not suffer from anemia still requires intervention focus on anemia because they might be nutritionally deficient and may have subclinical manifestation on anemia. So I think I'm personally very happy in the first 3 years of rollout of this program because we have managed to generate huge interest, and more specifically, the Government of India has provided adequate budgetary allocation for this program, which are being utilized at state level. The next level of challenge would be to strengthen this program rollout at states and districts and beyond. Thank you.
I think there is a bandwidth problem, Shivkumar. I think that's the problem with it.
Yeah. Dr. Yadav, are you able to? Maybe you can switch off the camera, sir, so that audio will be better and you can get better bandwidth.
Now it's better?
Yeah.
I think initial 3 years of the program, we are very satisfied with the rollout. Most of the states have rolled out the program, but the next phase, the challenge would be to roll out it at district level and beyond. Thank you.
Yeah. Thank you, Dr. Yadav. I will certainly get back to you more on the on this aspect of it. So I think we have Dr. V.K. Das online. Dr. V.K. Das is the Director of Medical Health Services, Dadra Nagar Haveli, Government Daman and Diu. Dr. Das, coming from a small state with lower population, how effectively and efficiently is its state implementing the Ayushman Bharat Anemia Mukt Bharat program? Would you have an advantage of having a lower population so that you are effectively and efficiently being able to implement this program to achieve the 100% objective, sir? Dr. Das.
Good afternoon, everybody, and thank you, Dr. Shivkumar. I would like to introduce my territory as Dadra Nagar Haveli, Daman and Diu. Now, Dadra Nagar Haveli is a tribal pocket amongst the three districts, and more than 50% of the population is tribal. And as far as NFHS 4 data is concerned, children between 6 to 59 months, they were 84% anemic. 80% of the pregnant women were anemic, and about 80% of the non-pregnant women were also anemic. But in men, it was only about 30%. So much before Anemia Mukt Bharat started, since our population was less, say about 3.5 lakhs in all, to 4 lakhs, what we did was from 6 months to 18 years, and from 18 years till 45 years, all female, and from 6 months to 18 years, male or female, both, we did hemoglobin at the base level of every person. We studied their dietary patterns. We have been given iron folic acid so many years, but still we found it very less. So we tested them, why, what is the problem, whether there's an absorption problem. And we also came to know there's an absorption because iron has two parts, heme and non-heme part. So the heme part was not being absorbed. And in the deworming thing, what we saw is, even after deworming twice in a year, still 40% of the population, this population, was affected with worm infestation. So anemia was not being corrected. Then whatever food was given, like through in ICDS and Anganwadis and schools and kitchens and PDS system, they were all non-fortified. Plus open defecation was rampant. So, and then there was no knowledge of menstrual hygiene. And samely, the habits changed. The habits of tribals, which 30 years back, they used to eat local food like ragi and some local millets. We started giving them polished rice in the PDS, and they all started consuming rice, and they stopped eating millets and selling the millets in the market. Just high and rich iron content. So this led us to start this, and plus the tablet of iron which we were giving, that used to cause lots of gastritis. So we replaced the capsule of iron, and we added vitamin C with iron. Secondly, for all pregnant women, usually what we saw is in the OPD, the gynecologist or our doctors are prescribing iron plus calcium. They were giving it together. We made a gap in that. We fortified all the food in Anganwadis. We fortified it in PDS systems. Food diversification we taught in the, we used our nursing colleges to teach people how to make good, rich, iron-rich food, vitamin-rich food. We taught them recipes. Through the forest department, we planted this drumstick trees all over. In every house, now you can find a drumstick tree. And we also tackled the non-iron anemia, like sickle cell anemia. We have a high percentage of 7 to 8% of sickle cell anemia. We tackled that also. And then we did hemoglobin every 2 months. And in the same time, we gave them therapeutic dose of iron and folic acid for people who are mild, moderate, and severely anemic. All severely anemic people were hospitalized and given blood or iron transfusions, and they were monitored. And I'll tell you, till last year I have the data. In mild anemia, we have a reduction of 43%. In moderate, we have 61%. and in severe anemia, we have a reduction of 81%. So this is the positivity which we have got. Now, way forward, another thing which helped us was we are digital till the A&M level. Our hospitals are paperless, our PHCs are paperless, our A&Ms are also paperless. We all use the software and we have all the data with us. So this helped us for tracking data and deworming also we did thrice, and behavioral change was addressed, and testing of now the only challenge which was left is for the correctness. We were using filter paper method for mask screening. If we could have some device which would do it at a lesser cost, we could do it more accurately. Because all anemic patients, we were then referring to the hospital, all moderate and to our PHCs, and then we are again testing it for the level of hemoglobin which was found. So I think yes, we have succeeded quite a lot with a good number of reduction in anemia cases in the UK. Thank you.
Very commendable and heartening to hear the actions that have been taken from a small union territory like yours. I could definitely hear myself coming from the diagnostic background. I could hear very loudly about the need for some kind of a devices for measurement of hemoglobin. So that leads to one question which I will ask in the next round. Now I'll come to Dr. Gautam Kumar Singh. Doctor, welcome. And I would like to understand from you, what are the challenges that are faced by the states and union territories in implementing 6x6x6 strategy of Anemia Mukt Bharat? You are also, it would be really appreciated if you could throw light on that aspect, Doctor.
Thank you. I hope I am audible.
Yes, you are very audible. Yep.
If you could switch on your cam also, that would be great.
I think the bandwidth is not great. We are having, like a DRDO building, like next to us. So they are, like jammers. Yeah. Yeah. So once I finish, I can, like do that. So as far as challenges being faced, by various states or UTs to implement 666 strategy under Anemia Mukt Bharat program is concerned, see, let's get one thing very clear. Public health initiatives are, formulated based on the extent to which it affects the, population or community, and it is backed by the evidence generated, by scientific researchers, right? However, like implementation of, like these initiatives, like may lack on one or more, like counts, which may include, like inadequate understanding among the, affected population or the community regarding the same being a public health problem itself, and, like hence, like a failure to convert what we, like think, is the right, intervention or, say a policy push into, their felt need, which is so, like important for, like a public health program to succeed. So that is one thing. Second, like it is also, like contributed, by, its implementation, by the healthcare delivery system itself. That includes, like, say, like inadequate, like public awareness generation activities, that, like we are not able to, like really, convince them, like what are the detriments and how, like beneficial, like these interventions are going to be. Also, like as far as, these Anemia Mukt Bharat and IFA supplementation is concerned, like there is, apprehension, about, side effects, like which is so intrinsic to iron. So we need to also, like take, like them into confidence that, like these are, like, more or less largely transient and those things. So I think the communication strategy has to be very, very strong and, like wide and, like consistent and persistent. So that is where, like many of the states, if not all, and UTs, probably lack. And like weaker implementation on ground is another aspect. Like with like many of like public health initiatives like being pushed on the back of ashas, it becomes like increasingly difficult for ashas to deliver everything. So like I'm not telling like we are like we are not averse to like doing it through ashas, but then like we need to like probably like scale it like accordingly. And I mean we can't overburden like ashas with so many things. So that is one important thing. Also like nowadays like individuals are like more and more assertive in nature, and like the evidence that we generate through scientific research is just not enough. So what actually they look for before like being a part of like these interventions is like solid evidence that they need to be a part of the intervention themselves. As an individual, they actually lack like iron stores, they have like low hemoglobin, and those sorts of things. And this is where like diagnostic things come into picture, and diagnostic tools that are objective in nature. So that is like important. Also like one thing is important. See, like IFA supplementation, whether it is for under 5, it is for 6 to 10 or 10 to 19, or for other age groups, these are either like weekly supplements or bi-weekly supplements in in case of under 5 like children. So this is an ongoing program. I mean year after year, the like children have to like go on taking these supplements. So like whenever we go in field like and talk to school children, they always ask one question. Like they started like having the tablets in 6th standard, they are in 10th, and they ask till what time we need to like take these tablets. So like we need to like we tell them like that the most of the risk factors remain. So like you need to continue. But this is like a question that like is asked every now and then. uh, like in contrast, if we like see National Deworming Day, wherein coverage is so high, it is contributed by a fact that it is like biannual, or sometimes in a couple of states annual activity. So that also helps. Like if compliance is a problem like with bi-weekly or weekly or weekly supplements. I'm not telling it's a faulty like program, but like it does like make a difference. Also like platforms, like if we look at 6x6 strategy, one of the age groups is non-pregnant 15 plus women. In many of the states, like in case of, see, like 6 to 10 or 10 to 19, the platforms are schools or Anganwadi centers where we have captive population. So like probably the implementation is that tad easier. However, in 15 to 49 non-pregnant like women, like the platforms, like the right kind of platform is in itself a problem. In all the states, VHSNCs or VHSNDs, whatever they call it in their respective states or UTs, is not so robust. So I think these are like subtle problems we need to find a solution to. Yeah.
Okay. Thank you very much. I think you have elaborated fairly well about the challenges that are being faced by the states and union territories. So coming back to Dr. Kapil Yadav, Dr. Yadav, have the regulatory agencies or the government of India set up any quality assessment guidelines in general for anemia diagnosis? And if they have set up certain guidelines, how effectively are these guidelines being implemented? And is there a mechanism to ensure that these guidelines are effectively implemented? It would be great if you could throw light on these quality assessment aspects.
Yeah. Quality assurance is a key component as far as diagnostic and laboratory procedures are concerned. And more so in case of anemia, where not only the diagnosis but subsequent treatment and monitoring is dependent upon your lab test. Government of India do has something that is known as essential diagnostic list, which lists out various diagnostics that have to be available at different level of healthcare facility. So if you are at a primary healthcare level, the different equipment is warranted. If you are at a secondary or tertiary healthcare level, a no clear-cut quality assurance guidelines available, but all well-established labs do follow both internal and external quality assurance mechanisms. As far as anemia is concerned, the challenge is even much bigger because of the large percentage of population that suffers from anemia, and they are not within the reach of established laboratories. So here we talk of what is known as point of care testing, where ensuring quality becomes even a bigger challenge because of the remoteness of the facility where these tests are being done. So I think that remains a very, very important aspect that needs to be built up into the program. And we are in the first phase itself where this diagnostics has been rolled out. But I think we do need to look at the quality assurance mechanisms very closely. Thank you.
Do you think that over a period of time these guidelines would be developed? If I have missed that point.
I think they should be developed because, as I said, if you take example of a pregnant woman, so she is tested somewhere around 8 to 10 times during her antenatal period. For minimum mandatory is 4 times, but she may get tested 8 to 10 times. And her treatment and classification would depend upon the cutoff that you have on hemoglobin level. So it's very, very important that you have a robust quality assurance mechanism. We at AIMS on our own have done extensive work on this aspect, and we do follow stringent quality assurance mechanism even for the point of care testing devices. But right now, I think it's not being done in public health programs by states because that will involve another level of challenge where you have to do a periodic calibration of the device that you are using and run a setup of known value samples that are external quality assurance samples on these devices. But I do think they are very critical and important.
Okay. Coming back to Dr. V.K. Das, Doctor, you were referring to the fact that currently hemoglobin measurement is done using the filter paper method, and then it would be good to have some kind of a device which would be helpful to give a more accurate quantitative measurement of the hemoglobin levels. Can you give what are the challenges in not able to have, because there are certain hemoglobin devices. There are companies who have been marketing in India, the multinational companies, and also some Indian companies are there. But what is the reason why a state like or in union territories like yours not able to use the point of care devices for measurement of hemoglobin? Another last point that I would like to say before I hand it over to you is that many of these devices are now digitally connected. So to the point that Dr. Kapil Yadav was saying that, quality and the remoteness of the thing. So if you measure them at a remote location, automatically the data can be transmitted. So could you throw light on the point of care devices, why you are not able to use it, etc.?
For any success of a public health program, all interventions or testings, whether in digital mode, non-digital mode, they have to be cheap. They have to be cost effective. The digital modes, whichever we saw, people came here, they were not very accurate, number one, because we tested parallelly in our labs also. And second thing, they were not cost effective. Like per patient, if I have to screen all my entire population, it is about 2.5 lakhs or 3 lakhs. To test everybody with this device costing 25 rupees per person is a huge cost. So we did try to negotiate with them, but none of them were able to bring down the cost. So this is the main issue with any government, any UT or anybody, because the cost has to come. That is the only way forward. If the cost comes down, accuracy is improved, then yes, digital will be the best one.
Thank you, Doctor. Dr. Gautam Singh, one important aspect after the pandemic, the COVID-19 pandemic came in, is many of the things have got disrupted. The routine processes have got affected significantly. From your perspective, how do you see that the COVID pandemic has impacted the implementation of how did the COVID pandemic impacted the implementation of Anemia Mukt Bharat program? Has it slowed down the whole process, or it has put your targets off? Would be great to hear from you, sir.
Thank you. I mean, this pandemic has, taught us, a lot. Having said that, various platforms, for implementation of Anemia Mukt Bharat have been institutions, educational institutions in particular, and also Anganwadi centers. For, if we, take an example of Delhi itself, we have had, 4 waves, the country had 2, but, Delhi, faced 4 waves in total. And the educational institutions have been, closed for, better part of last 18 months. Once we opened, and then, again we closed, and the latest is, the whammy of air pollution. So, it has definitely, set us back, big way. However, we were able to respond to the challenge. And, what we did in Delhi is, we handed over these IFA supplements in the form of tablets to parents, along with a handout that carried the message about how to identify anemia, basic things, what is the importance of IFA supplementation, how to take it, what are the do's and don'ts, and what are the expected kind of events that are seen as adverse, and how to handle this. So everything, a hard copy, printed one was given along with the, IFA tablet. So this has been a standard practice, when, schools go for summer breaks. So we, implemented it. The only problem is, we don't get the data, back, in these cases. So that was, one way we did it. Also, for 6 to 10, for which, the platform that was envisaged under Anemia Mukt Bharat were, primary schools. So we have also, implemented this, through our ASHAs, on the same lines that we are doing for, under 5, IFA syrup. So we have been able to, find, ways to implement. However, definitely, the scale of implementation, because see, in any state, the entire population is, not covered through ASHAs. And, in case of Delhi, it is nearly 55 to 60% of the population that is being catered by ASHA. So there are a lot of, children that we are not able to reach out to through this mechanism. So there will be, shortfalls if we take alternative mechanisms, because, bringing other people on board, civil society organizations, and, even WCD for that matter, it's a time taking process, and it takes a lot of effort. So yeah, we were able to find a solution. Many other states have also, I think done wonderfully well on these aspects. But yes, having said that, all said and done, it has definitely, done us no favor, COVID-19, as far as the implementation of, these public health interventions are concerned.
Very good. Thank you, Doctor. Thank you very much. So we come almost to the end of the first session. So I would like to say the understandings or learnings from this thing is the implementation of Ayushman Bharat, as has been told by Dr. Kapil Yadav, is that the initial 3 years of implementation has been good. There need to be more progress and an aggressive implementation of this. It is very heartening to note that the great work done in smaller states like smaller states and union territories, where they have been doing multiple interventions, trying to educate the people, and then, despite the challenges that they have, despite the fact that the majority of population is tribal, they are making all efforts to do it. However, it would be very important for them to have a robust mechanism through which they can quantify the hemoglobin levels. We also understood through this session that there are no clear guidelines or regulatory guidelines that are available, and it needs to be established. And then lastly, certainly the COVID pandemic has affected the overall implementation of Anemia Mukt Bharat. I think, it has been a wonderful session, a lot of learning, at least personally for me. I'm sure it has been the same for all the others. I would like to thank all the panelists on this session for participating and educating us. Thank you very much. I would like to hand it over to Mr. Shankar. Thank you.
Thank you, Shiv Kumar. Thank you. That was wonderful. I think quite an educative session. The next session is on role of public-private partnership in boosting accessibility of anemia testing. And we have with us as speakers, Ms. Ranjita Vinil, founder and director of Sarathi Healthcare Private Limited. A management graduate with a B Pharma, she's a veteran in patient relationship management, having close to 18 years of domain experience. Ranjita's core experience of patient relations and work in the area of education of doctors, patient masses, paramedics helped the inception of Sarathi Healthcare Private Limited in 2008. The next speaker is Dr. Jithul Albina, but before I come to that, I request Dr. Das to stay back for this session too. Dr. Jithul Albina serves as Division Head of Service Provider Engagement, Provider Operation Empanelment at National Authority, NHA, Government of India. Previously, he was the Joint Director, Hospital Networking and Quality Assurance, National Health Authority, Ayushman Bharat, Pradhan Mantri Jan Ayog Yojana, Government of India, and he's working in quality healthcare service since 2002. The next speaker is Dr. Harshvardhan Dere, is currently serving as Director, Program at America's India Foundation with over 11 years of experience in handling public health projects and programs. He has been a program consultant to the state governments and UNICEF. Over to you, Dr. Shiv Kumar.
Thank you, Mr. Shankar. It is my pleasure to welcome Ms. Ranjita Vinil, Dr. Harshvardhan, and Dr. Meena. Okay. Before we get into the discussion on the public-private partnership, I think all of us are aware that government cannot run everything. Government has to depend on the industry or private entrepreneurs to ensure that majority of the programs are successfully run or successfully implemented. In many sectors, especially the transport sector, the infrastructure sector, etc., public-private partnership has been one of the key strategies that have been followed. And healthcare sector also has started a few years back implementing the public-private partnership aspect. They have been successful. There are challenges. Coming from the industry side, yes, we have been successfully able to participate in some of the PPP programs. But while overall it has been successful, but there have been challenges which are all anticipated. So it would be very interesting. And a program like Anemia Mukt Bharat is a mega project, and it's a very challenging one, that too. So it would be interesting to understand both from the government side and also from the private players as to how public-private partnership is boosting the accessibility of anemia testing, or ensuring that the implementation of the Anemia Mukt Bharat happens speedily. So my first question to Dr. Ranjita Vinil is, Madam, one of the key interventions is prophylactic iron folic acid supplementation in the Anemia Mukt Bharat program. How effectively this intervention is being implemented? And do you see a significant improvement in bringing down the anemia and achieving the targets? Have there been any strategic alliances through public-private partnership in general that IFA is provided to the needy? It would be interesting to hear your thoughts on this, Dr. Ms. Ranjita. Over to you.
Thank you, Dr. Shivakumar. Thank you for the kind introduction. So I think as an organization, what I would be able to share with you is lot of other examples where the private-public partnership has given the outcomes that that is desirable. But coming back to your question on the folic acid, and I hope it's done because we are not part of the AMB, and I'm quite sure about the impact that it will have in all sectors, considering that this is the most important support that we can give, be it to the primary healthcare centers, whether it's, I know somebody mentioned about the ASHA workers and how they're loaded and how they can take this, but I'm sure there are many ways we as a private company can work along with the government to see that it reaches the right people, and enough must be done on the government side. Because we've not worked in AMB directly, I'm not able to answer this question beyond this. However, I would also like to tell you examples of multiple other initiatives in other therapy area that we did in where we not only, I think all these examples are of various kind of cancers, NCD, hemophilia, although there's a lot of participation and support from the government, but still how as a partnership we help in, organizing the protocols, having the outcomes, help because, we talked about the mega numbers of anemia. Similar is the case of some of the other therapy, and how we helped the government and the setup that we are operating out of to reach out to more and more with the screening, counseling, so that we ensure that all the other support, including support with the drug, etc., is given to this population.
Okay, it's fair. It's fine that you do not have really participated in the Anemia Mukt Bharat, but from the overall perspective of PPP program, where you have participated in other kind of activities on this front. So, what are the three biggest challenges, irrespective of whether it is Anemia Mukt Bharat or any diagnostic project or any radiology program? What are the major challenges, or at least list three challenges that you anticipate in successfully running a PPP program?
I think we've been running. So as an organization, I think even though we are a private organization and it's not comparable, but we've almost touched 25 lakhs patients of different disease area, and a lot of them under public-private partnership. We work quite a lot intensely in the NCD area, cancer, hemophilia, even Gaucher. So we worked with the government and other companies in this area, working with patients, because that's what we primarily do. Exactly, a lot of elements of the services that we are talking about in Anemia Mukt Bharat are exactly what we do for other therapy areas. And I think the advantage is when we have these kind of models, we work together, all stakeholders. So there's less bureaucracy. There is more, the KPIs are more driven, and the outcome that we are expecting is more measurable, and government and state government are doing what they can. But I think the best example is in anemia, that there's so much more to be done, considering more than 50% of the lactating pregnant women or adolescent women are anemic. There's I think all kind of awareness that is possible to be done in different modality needs to be done to reach out. And I think we don't have a better example than COVID, when not only India but I think the whole globe has been working, and still we know the different kind of apprehension people have on the vaccination or understanding about the whole subject. So when we're talking about anemia, there's so much more to do, that whether it's working with primary healthcare center, whether it's working with gynecologists, because a large percentage of women, and it's not limited to only rural India. We all know that there are issues even in urban India. Now, how do we work with the pediatrician? Now, government is doing a lot in other things, but can we also have parallel channel in different kind of partnership that reaches the root cause and also kind of works along in terms of education, awareness, support, and all the strategies we are talking about 6x6x6. I think those are all things that can be worked parallel with these kind of partnership. And I think digital intervention, point of care, and in communication campaign, and this, we talked about the iron supplementation, iron and folic acid. All of these are subject matters that I think these partnerships can be of help. And Dr. Das did mention about point of care and the cost being a limitation for taking the screening to the level that perhaps government would want, and there's being a little bit of a deviation. But the point here is, because we do a lot of screening in many therapy areas to for various reasons, right? Early diagnosis, less complication, better treatment, more empowerment, so that less disease burden. So now the whole point is
that takes me to a question to Dr. Das, actually. Dr. Das, a state like, or a union territory like Daman and Diu, or any of the other states, what has been your experience from the government perspective in entering into a public-private partnership agreement? And have you encountered any challenges in that direction? It would be good to hear from you from the government perspective, Doctor.
As far as public health is concerned, no, we haven't entered into any PPP model till date. And neither we have been approached by anybody, neither we have done it. Because in healthcare, in the UTs, especially small UTs, we have a robust health mechanism. Like we have ASHA workers, we have ANMs penetrating deep into every remote areas. And even because of non-paucity of funds, we have almost completed all the wellness centers which is required to be completed till 2024. The targets which has been given by Government of India, we have already finished. So for every village or between two villages, we have a wellness center, we have a community health officer, we have ANMs, we have male workers, we have ASHAs. So for that to reach, outreach is very good as far as smaller UTs are concerned. It's not like state. And so I think that PPP model we don't require in the UTs. As far as hospitals are concerned, yes, we have few of the PPP models running in the hospital, like especially radio imaging, which we find it difficult to get specialists from radiology and imaging people for CT, MRI. That is, of course, run on PPP mode, and similar super specialty treatment is run on PPP.
Okay. So let me come to Dr. Harshvardhan. Dr. Harshvardhan, can you give some examples of successful cases where public-private partnership has been a key factor in the success of either Anemia Mukt Bharat or a program similar to like this? And also it would be very interesting to note or understand from you 3 to 5 key roles the private sector could participate in the implementation of a program like Anemia Mukt Bharat.
Yeah, and good afternoon, Dr. Shivkumar, and thank you for that question. I hope I am audible to all of you.
You are audible, yes.
Thank you. So coming to your first question, I would say that I would like to speak about my own experiences rather than we are not involved with Anemia Mukt Bharat, but we are doing our own programs for anemia. And one of them is the school health program, where we are actually screening the school going children. And these are MCGM schools where we are working with directly with the municipal corporation of Greater Mumbai, where we are going and screening the children, screening for not only for anemia, but also for vision, ear, and other diseases. And then also giving them the treatment. And along with that, the health education. And what we found was that we have to reach, we have to reach these people. And there is a lot of people or a lot of children or adolescents who are being left out of this whole Anemia Mukta Bharat, where the government, I am saying that will require a support from the private sector or from the NGO, INGO sector, development sector. And this example also shows that there were challenges, especially during COVID-19, where we had to reach the community directly because the schools were closed, because the children were at their homes. And these are very much slums communities, children that we are speaking about. So it has been a fruitful experience by that standard. Another one is our NCD, and this is where I think Dr. Das has said that it has to be feasible and cost effective, and I agree with him. But in our NC Disha program, which can certainly mimic the Anemia Mukta Bharat program, is that we have our own community health volunteers whom we call Arogya Mitras. And what these Arogya Mitras are doing is that they are going for household visit and screening the household individuals above 30 years of age for diabetes and hypertension using the digital equipments. And that has been also fruitful. And this is also being done with the MCGM, which is very much a part of the NCD, whole over NCD initiative by the national government. And that is, I think, a major challenge, that the government in itself has a very robust PPP policy for NCDs rather than for anemia. And this is where I think the first step can be taken. On your next question of where 3 to 5 roles that the private sector can play, I would say that the first and most important role when we look at the 6x6x6 matrix is on the institutional side, where we can do advocacy and where we can be very, very helpful in streamlining the interministerial convergence or coordination. We can, our private sector or the INGO development sector has a very robust mechanism for making that happen. And it will be a great thing to do, whereas where we are speaking about making policies or having policy briefs for Anemia Mukta Bharat PPP model. Another thing that I think where we can look into is direct support to the government for many of the implementation things, like government is doing especially very well. If you see in IFA, if you see NFHS 5 data, the IFA supplementation is increasing, and so is anemia is increasing. So there has to be, and it has been included in Anemia Mukta Bharat, where they are speaking about diet diversity, moreover health education, balanced diet, and other things. But another thing is that right from BCC on that implementation, point of care testing, digital testing is an important parameter in that 6x6 matrix, where we can provide handsome support to the government. Another of the model can be for supply chain, where the private sector has immense experience, and that can prove useful in the government also, in the public health also. For another of the, and these are low-hanging fruits, means we are ready to support, I would say. These are some of the low-hanging fruits. Another of the two parts, I think, that will require a greater overreach are research and food fortification. These are the two things, major things that the private sector can support the public sector, and there can be a hugely successful PPP models in this.
Yeah, Dr. Harshvardhan, you have elaborated very nicely the role of private sector and how the private sector could help the government in implementing programs like Anemia Mukta Bharat. Ms. Ranjita, I think, I understand that, your organization does not have a direct direct participation specifically for Anemia Mukt Bharat. Something similar to what I have asked Dr. Harshvardhan is, how could private sector, from your perspective, how could private sector be effective, especially in the distribution or the logistic support that could be provided, or how you could enter into a PPP kind of an arrangement with the government, so that the objectives of the Anemia Mukt Bharat are achieved much more smoothly.
So, although I think we've done a lot of work in, anemia and women health, although we've not worked on the, AMB, but the whole point here is, as private partners who have expertise in dealing with health education, women education, building awareness, doing a lot, having digital and point of care, equipments, solutions that can help reach more number of people and create. For example, when we do this, we really use a lot of these point of care products for our screening. Where do we do the screening? We do screening across different states with nutritionists who not only administer the algorithm to check their nutrition level, where is it, also use these machine point of care devices to do the screening to make them aware. And they are the ones who are either, pregnant or adolescent age or lactating mothers, and these are the people that we may need to be made aware of importance of anemia so that the next generation does not have it. I think these are some activities we already as an organization have been doing in nutrition space. Coming to various kind of using digital platform and having a model using digital as well as human resource, we do a lot of projects. So for example, I think 12-13 years ago, Punjab, Haryana, we know how the hepatitis scenario was. We were the company working there in PPP model with Punjab government. Now we all know hepatitis C is all supported by government, the whole treatment to, including a lot of work in the screening. But 12 years back, when we would run these campaigns, we worked on various levels: screening, educating, making sure they've reached the right doctors, counseling to make sure that they understand the importance of taking the treatment, and also compliance. And when we're talking about hepatitis C treatment, it was also about affordability. We also floated a loan along with our partners to make sure that people who couldn't afford upfront had the facility to consider and be well. So I think a lot of these elements of initiative that private companies are doing in the space of health education, awareness, be it anemia, NCD, like somebody mentioned about NCD. And so we have done immense amount of work in NCD because there is a policy and there's a structure, but the element of work remains the same. And we, as in private companies, can work on various elements. And this is all part of your 6x6x6 strategy, actually.
Yep.
Whether it is distribution of products, whether it's iron folate, it's of awareness campaigns, home to home, using digital medium to analyze the data to make more sense and do the right places. So all of this is something which, as a private organization, we could support the government.
Yeah, thank you so much. So I think we are up in terms of the timing. So I would like to summarize the discussion points of this session on public-private partnership. There have been some interesting aspects that came out, and I personally feel that the government should enter more and more into these kinds of programs so that they are mutually beneficial. While the private sector looks at profitability as one of the aspects, but at the same time, the collaboration with government in implementing certain programs like Anemia Mukt Bharat would be mutually beneficial, and it will be a win-win situation. See, some of the roles that the private sector could play, as has been expressed by Dr. Harshvardhan and Ms. Ranjita, have been advocacy is one, education is the other important aspect. very, very important aspect is the supply chain, because ensuring that the folic acid tablets and folic acid is reaching the nook and corner of the country is very good. And then the private organizations could work on the research program. And last but not the least is the utilization of digital platforms, where the expertise for the private organizations are quite good. So and one another interesting aspect that we learned during the course of this discussion has been the smaller states that are represented by represented by participants like Dr. Das. They are fairly well equipped in terms of staff and support. So they still do not see the need of a public-private partnership. And I am sure as the sir, could you put your phone on mute if you don't mind? Yeah. As the volume of work goes up, and as the requirements, for example, in a state, in a union territory like Daman and Diu, point of care is a challenge, or the technology in terms of determination of hemoglobin levels has been a challenge. I think a PPP program would be very, very effective. So these are my thoughts and summary on this program. I would like to thank all the participants for actively engaging themselves in this program. I would especially like to thank Dr. V.K. Das for staying back for the second session and giving his inputs. Thank you very much. Over to Mr. Shankar.
Thank you, Dr. Shivkumar. The last session, the third and last session, is on National Digital Health Mission, a prospective enabler for Anemia Mukt Bharat. And we have with us Dr. Arun Kambat, who serves as advisor to Access Health Digital and member of board of advisors of multiple companies. He has served on a variety of organizations, political, non-political, business, and public good, including prestigious think tanks and not-for-profit initiatives in healthcare, digital health, pharmaceuticals, sustainability, besides being an engaging public speaker, advocacy maven, and campaign strategies. The next speaker is Dr. Hema Divakar, quite well known in HEAL platform. She's the technical advisor to Ministry of Health and Family Welfare and past president of the largest body of specialists, or the FOXA. She has been working in the space of women health and have given 3 decades of dedicated service for women's healthcare, pioneering innovative research, translating it to reality and influencing policy changes at the national level. The last speaker is Dr. Virendra Singh Halawat, serving as Deputy Director, National Health Mission Nodal Officer, Anemia Mukt Bharat, State Immunization Officer, Haryana. Over to you, Dr. Shivkumar.
Thank you, Mr. Shankar. It is my honor to be part of moderation for a session like National Digital Health Mission. This is the buzzword now, and this is what is required. The digital programs in every single aspect of life is very, very critical, more so in the healthcare. And then the digital connectivity and digital programs have become much more important post the pandemic situation.
Shivkumar, sorry to interrupt you. Dr. Archana Mishra, who was supposed to join us in the first session, has now joined in. She was busy with the Chief Minister discussing some policy matters, so she will be part of this session. Dr. Archana Mishra.
Yeah.
Thank you. Thank you.
Welcome, Dr. Archana. Okay. So then let me not spend a lot of time on my introduction on this one. Let me go directly, Mr. Arun Kambat. Sir, have the responsible persons in implementing Anemia Mukt Bharat been able to interact with NDHM to utilize the tools and activities in speeding up the implementation of Anemia Mukt Bharat strategies? So it would be interesting to hear your thoughts on how the collaboration is happening and how they have been able to reach each other.
Please unmute yourself, Mr. Gumbat.
Thank you very much for inviting me to share my thoughts on this. Whether the leaders of Anemia Mukt Bharat have reached the NDHM or not, I'm unable to say, because that's not my. That's not my. I'm not in. I can't possibly say that, because that's only NDHM or somebody in the government or NHA can say that. I work for a not-for-profit that is mostly on the technical and design side of the digital health part. And therefore, I can talk about how digital health can help, but I can't possibly comment on whether Anemia Mukt Bharat has made any contact with the digital health mission.
Okay.
Yeah.
No problem. You can give your thoughts on how the digital programs could be helpful in implementing the Anemia Mukt Bharat.
I'd be happy to. I'll keep it very simple and layman-like, instead of getting into technology, because that confuses the issue very often. Yeah. To be able to deal with any communicable or non-communicable disease, or let's say a black swan event like the COVID-19 that happens, what you need per se is near real-time data. That's really the bottom line, right? And considering that you need real-time data, it's not possible to build healthcare IT like they used to 10 years ago in terms of building systems with servers and client-server technology and networks, and building customized software and then imparting training. The total cost of ownership and the time that it takes to do those things would kill a program before it starts. Fortunately for the world, about 10 years ago, we got into what is called digital technologies. And I've been in this healthcare IT space when the word digital health did not exist. Yeah. So digital health technologies are basically things like microservices. For example, if you talk about the things that you use like WhatsApp or Facebook or whatever, these are based on microservices. They are open source. And the advantage is that they leverage publicly available infrastructure. So there is no purpose-built infrastructure that it needs. They leverage devices that are already there. And therefore, you can imagine that the capital cost of building a digital health solution or a digital health ecosystem is, let's say, almost 90% lower than building the conventional force. I mean, I wouldn't argue that number, but it can be anywhere between 50 to 90% lower than a conventional system. And therefore, the digital health mission. The National Digital Health Blueprint kind of laid the foundation for people to design the kind of minimum viable products and the interoperability tools and the microservices which people could use and build solutions based on what they need. So the crux really is to be able to build quickly, build as you go along in a DevOps fashion, and see that data flows in based on international standards, based on metadata standards, so everything goes into the right box, to say in a layman fashion. And then, or let's say that you put a size 9 foot in a size 9 shoe instead of putting a size 10 foot in a size 9 shoe, right? So that's the whole purpose of this thing. So essentially, when we talk about anemia, now I suffer from a beta thalassemia myself, so I know that it's a cause very dear to my heart, quite prevalent in my family. Yeah, and anemia can come from, let's say, 8 or 10 different mechanisms in the body, right? So essentially, it's about being able to capture real-time data and then do analysis on it, which is also part of digital health, so that you can, sort of identify the right solution for the right person instead of trying to kill everything with a fly swatter, right? You can personalize treatment, bring the costs down, and digital data would then make it possible to solve the supply chain problems that have been discussed in the previous sessions, because provisioning is a very important part. Getting the right thing to the right place in the right time It's all based on data, right? So I would say in very, very simple terms that digital health is absolutely the bedrock of addressing a problem like anemia, right? You have, in the US, you have about 1.7 deaths per 1 lakh people due to anemia, various kinds of anemia. I'm sure the number is higher in India, right? Yeah, thank you.
Thank you. Thank you very much. Really appreciate your inputs on this.
Dr.
So
Shiva,
before I go to Dr. Shiva,
again, sorry to interrupt you. Dr. Jithul Albina has also joined just now. So we have more speakers in the session. So I will extend the session by another 15 minutes. So he has also joined us, 2 more speakers.
So then that would be good. So now let me go to the senior officials in the panel. So let me first go to Dr. Virendra Ahlabat. Sir, you come from a forward-looking state like Haryana. Okay, I would like to club 2-3 questions into one question. Okay, for the effective implementation of Anemia Mukt Bharat, how effectively are you using the digital programs? Number one. Number two, has the state been able to utilize programs like public-private partnerships? And the last thing is, has COVID impacted the implementation of Anemia Mukt Bharat in a state like Haryana? So I apologize for asking 3 questions in one question. And I think, that would really help us to get a overall input from you, sir.
Good evening, everyone. And thanks for having me here. Sir, first of all, regarding the implementation using the digital platform, it's a big challenge nowadays also. Despite we have grown so much during the last 1.5 years during COVID-19, and everybody is using this platform for implementing each and everything, including healthcare systems. I must say we have to simplify our portals and the softwares up to the ASHA levels, where ASHAs, Anganwadis and ANM can use it. Basically, they are the end users. And now we have introduced these tablets to we have given the tablets to the ASHAs in 12 districts. We have out of 22 districts, in 12 districts where they have started immunization on this tab, and it is synced with the RCH portal. Similarly, we are also trying to triangulate this with anemia also, anemia and maternal health services. So this is very important. Unless we collect the data, we collect the data manually from the ASHAs, Anganwadis and ANMs, then we digitalize it. It is better the end users, ASHA, Anganwadi and ANM should be able to use this platform. Then the 100% data will be uploaded on the portal, the software, and the work done in the field will be reflected 100%. This is very important. At state headquarters, sitting at national headquarters, it is not an issue for us, digital platform using, and we have so many people, IT literates and everything we are having there. Important. This is the issue, and this is a challenge also in today. As I have already told, we have using it in the 12 district for immunization. Now we have started using from Dhanush is a partner, Anmol tablets we are using. Now we will be doing it in another 4 districts in 4, I think after 4 months, and we will also move to the maternal health services and anemia also, sir. Okay. Sir, second question you have asked me regarding the PPP model in tackling anemia. We have already started doing this. We have involved IMA in identifying the anemia prevalence, and we have asked the IMA chapter of Haryana to keep a data of their nursing homes or their private hospitals. Out of people, it is a opportunistic data coming to patients coming to them, out of which how many are anemic and severity of anemia also. Beside this, sir, they have also offered to come forward to do a survey in their areas regarding the anemia prevalence. And they have also started in some districts like Ambala, organizing the camps, T3 camps. They are helping government in organizing T3 camps in the district, sir. So regarding the COVID-19, impact of COVID-19 in implementation, definitely, sir, I cannot deny and nobody can deny COVID-19 pandemic has affected each and everyone adversely, including all national programs. And as I'm also looking after immunization in my state, and I can see the clear-cut dip of 5 to 6% during this current year in immunization. And similarly, the iron folic acid distribution compliance, we cannot have the compliance during this because as the Anganwadis, Ashas and ANMs, they are overworked. They feel that they are overworked and they are not able to follow up for the compliance at least. They distribute the tablets and the syrup in the on the house-to-house basis as we have directed them. But compliance is an issue during this COVID-19 pandemic. This is the issue. Number two, sir, we are not able to organize the VHND, UHNDs and other MA meetings. And similarly, HB testing cannot be done without holding the camps like this. And when you organize a camp, you have to have someone to supervise them also, so that the things go smoothly and things are recorded also. Activities are recorded also. So this is how it is being affected, sir, at this moment.
Thank you very much, Doctor. You have very elaborately and to the point, you have given an overview, and it's very heartening to note that a state like Haryana is doing multiple things, and I'm sure many other states would follow suit.
Sir, one thing I would like to add also, we have also prepared a booklet for the school curriculum, and we have shared with the school education department of Haryana to inculcate in their curriculum regarding the anemia, sir.
Oh, very good. Yes, excellent. That's great. So now let me come to another important and a large state like Madhya Pradesh. Dr. Archana Mishra represents that as a Deputy Director, Maternal Health and Maternal Health in National Health Mission Program. Okay, Madam, I know it would be very interesting to know how you have been able to manage the Anemia Mukt Bharat program in a large state like Madhya Pradesh. Have you been able to use any of the devices or technologies for measurement of hemoglobin? And what are the challenges that you have been facing? And do you think that integration of testing devices, point of care testing devices or hemoglobin testing devices with any digital program would help in accelerating the Anemia Mukt Bharat program? Madam, over to you.
Thank you so much. First, I would like to thank the organizers for giving me the opportunity to share my thoughts. And I can see Dr. Hema, and she's actually the the motivator for Madhya Pradesh, who has guided us to bring injection FCM in the state to go for digital hemoglobinometer. And Madam, I would like to share with you as well as with all the experts that now we are using injection FCM for the postpartum anemia cases, and we are monitoring also. Actually, for the antepartum, still we are not using. We are waiting for the green signal from Government of India. But for the postpartum, we are doing it. And regarding leveraging technology for estimation of hemoglobin levels.
Dr. Archana, can you switch on your video, please, so that we can see you? Yeah, thank you. Yeah, yeah.
So we went for a rate contract for digital hemoglobinometer, and we thought that we will go for strip based digital hemoglobinometer for the use of ANM at VHND level, and QA based for the use at facility level. And we went through the specification of Joint Secretary Government of India. It was, though it was suggestive specification, and we floated the tender accordingly. But unfortunately, we were not able to finalize the strip based one, so it's still in the process. But we have in our state Kuwait based digital hemoglobinometer at PHC level, and we have devised a mechanism that all pregnant women should at least go for one checkup, either third or fourth checkup at PHC level by a sector medical officer or CHO, so that her correct estimation of hemoglobin is done. And it is being used across the state. And with the launch of Laksh program, it says that we should have point of care device in labor rooms also when the women comes in emergency. So we have provided digital hemoglobinometers to some high delivery load facilities, including district hospitals. So they are using that. And the rate contract of QAIDs have been done for 3 years. So device was for one time, and now the rate contracts of QAID is still valid. And for the VHND, we are still waiting for the tender process to get finalized. And once it gets finalized, we will have digital hemoglobinometer at for use of CHOs and ANMs also. And we have tablets with our ANM. She's using Unmol, and she is capturing data related to hemoglobin in her Unmol. We have customized our Unmol based on the state's need. Like if the woman is moderately anemic, hemoglobin level is less than 9 grams, we are giving iron sucrose. So the pop-up comes and gives an alert sign, and how many iron sucrose injections are given. If the hemoglobin level is less than 7 grams, whether she was given blood transfusion or whether she was referred to a higher institution. So we are doing that. Though because of the pandemic, the things have gone back, but still we are trying to bring them on line. So this
have you been able to use any of the public-private partnership programs? Have you collaborated with somebody on taking the Anemia Mukt Bharat program forward?
No, only the PMSMA, where the private practitioners are coming to monitor, to do antenatal checkup of women in the second and third trimester. They are identifying the high risks and referring the women for management in our institution.
Okay. Thank you, Doctor. Thanks.
Thank you.
Really good to know that an eminent personality like Dr. Hema is fully aware of it, and is supporting the government, Madhya Pradesh government. And also, it's very heartening to know that you have been using the technology very effectively in taking forward the Anemia Mukt Bharat. So let me come to Dr. Jithul Albina. Doctor, welcome back again. We were part of the program last time as well. I have a couple of questions. Actually, I wanted to hear your
Shivkumar, we cannot see you, Shivkumar. Can you switch on the camera?
Yeah, sorry. Apologies. Yeah. The last time, we would like to hear your thoughts on how the public-private partnership programs need to be built up to take a program like Anemia Mukt Bharat forward, and what are the challenges that you envisage, and what are the benefits that you would see by implementing a program, implementing a process like Anemia Mukt, process like public-private partnership. And lastly, I know that we have spoken about the point of care testing tools or devices for the quick treatment provided. So have you been able to identify any such tools so that the quicker measurements could be made. Dr. Meena.
Yeah. Good afternoon, everyone. First of all, I heartily feel very sorry for late because of some important meetings. I think so the Anemia Mukt Bharat is really a very important issue. First of all, related to the public-private partnership. As you say, if you know that the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, already our private hospital is also impaneled. So related to the anemia, because after this implementation of the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, more than 50% female take the treatment, and this so that the female goes to the hospitals if you give the better quality healthcare services, and out of 50%, most of the going for the private hospitals also. So this is very important. If the females and especially the child take the treatment related to the disease or preventions, then 100% the anemia is preventable. Also, the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana also thinking the diagnostic test, because presently our package is the cumulative with the procedure as well as diagnostic. But now we are thinking that diagnostic test should be a separate. So if we separate the diagnostic test, then any female or any child or any persons come for the anemia test, we give the e-voucher also. We are also thinking for the e-voucher facilities. If any beneficiaries want to test, laboratory test, then we give the e-vouchers only for the particular test. So it's a very important. If we give the e-voucher only for the anemia test, then 100% the anemia test is done only, because this e-voucher is not expenditure in the other activities also. So this is also digitally very important things. If any children's or any beneficiaries come with the anemia and they advise for the anemia test digitally or any laboratories, then beneficiaries on the mobile number e-voucher is coming for the anemia test and go to the laboratory and take the test and then reports. So it's a very important thing, especially to Ayushman Bharat Pradhan Mantri Jan Arogya Yojana is already thinking on this issue, which is already implemented recently, and our Honorable Prime Minister is also very keen to implement this. Related to the private-public partnership, because most of the private hospital is also impaneled in this area, and the awareness program is also doing, especially awareness program related to the anemia anemia prevention. So because now if you say the NFSA data and recently published, I think so it's a very important that the number of the anemia is also increased. So related to the private, the awareness program is very important, and especially involvement of the NGOs, which is the private NGOs and other things, because in the anemia only prevention is better than the cure. The reason for the anemia increase in the recently days, it may be a different reasons is there, because of the lack of the nutritional nutrition. I think so this is the very important because we eat some things but it's not a nutritious, and that's why the anemia is increased. Awareness is no, beneficiaries know, or most of the public is know that this is the anemia, but the nutrition activities, it's also very changes, because previously most of the thinking are we eat like the bajra and godo, but nowadays if you say that kitne log bajra khate, I think it's a very difficult. Very less pupils take the bajra and others goods, and that's why the nutrition is very important for the anemia prevention. Related to the digital, because when we say for the anemia preventions, we should ensure that we should examine all beneficiaries preventively by the digital platforms, and which is very easy and affordable and acceptable. If any test which is easy, affordable and acceptable, then public is very aware, and we will use the anemia beneficiaries and identify the anemia beneficiaries. And previously speaker already said that it is very important that the trained persons related to the ANMs, ASA and other things is also very important. And I think so one is the important, the awareness program in the school health program is also very essential, because when any education give to the school, the child is very active and they discuss in the families. And that's why the school programs, the anemia awareness is very important through the NGO, through the private public partnerships and others. And also we aware the publics through the Bhavai programs and others, local Natak, Nuttak, local jo bhi hai. Then others important is the big holding process, that what is the problems of the anemias and especially the complication of the anemias. So I think this one is the very important awareness by the public-private partnership through the NGOs, through the trust, through the hospitals, and the digital platforms like the e-vouchers, so that the beneficiary is very easy and take the treatment and e-voucher only for this test. Then it's a very easy that this beneficiary use the e-voucher only for the anemia test. And also the digital platform and also training to the ANM, ASA and other volunteers also. If anyone volunteers, then we are also prepared the volunteers. Like in the Ayushman Bharat, we are also have the PMAMs. We are also have the Ayushman Mitra. If any beneficiaries take the Ayushman treatment and they are voluntary as a Ayushman Mitra, they will also aware to the publics for the anemia also. So I think this multiple activities required for the prevention of the anemia.
Dr. Shiva?
Very comprehensive, Dr. Meena. And I think, it is really heartening to know that so many activities are going on. And I'm confident that if they are effectively implemented, the goal of the thing will be achieved much earlier than what it is. Yeah. So I would apologize to Dr. Hema Divakar for coming in the last, but that does not mean that she is the most important person in the hemoglobin measurement and the women healthcare. So I have a couple of questions to you, Doctor. I will ask both of them together and you can answer them. While using the digital methods of hemoglobin determination, what are the gaps that have been encountered and how these gaps are fulfilled, and then how we will be able to overcome these gaps? Number one. The most important question to you is, Dr. Hema, is what is your vision on the digital integration into Anemia Mukt Bharat program? I think you are the most competent person to answer these two questions. From the clinician side, we had a lot of people from the private sector, people from the government, but from the clinical side, you are the person. So please, we'll be eagerly awaiting to listen to you.
Thank you, Shiva. It is SSNS, Swadeep, Srivastavaji, Shankar, and Shiva. The three S's which make for a big yes on today's program. It's very symbolic that have been questioned the last, because it is the persistence which matters. I have been in this space of trying to do something about the issue of anemia, which we know why it is, we know what to do, but still over the decades, we have move the needle just a little bit forward, but not too much. So to remain persistent in this space, to fulfill the unfinished agenda, Shapat, as we call the resolve to, move on in our journey to make a difference. So that's the first comment I would like to make. And thanks to all the other very distinguished participants here who had their own viewpoint. I would say that whether it's in private or in public, let's not go with the presumption that everything is so great and so okay in the private, because it's not. Because we have enough and more incidents of anemia right across all age groups in the private segment as well. So when you have consistently asked about public-private partnership, you must also think of what is the private doing, where they can reach everything and anything is accessible to them. So the digital methodology has to be exploited much more than what it is happening as on today. The reason being, both the consumers and the providers, somehow only in the healthcare space, we have been slow for its adaptation. Because consumers, you see, everything they'll do digital. They book the tickets, then they will do the online shopping, they'll do groceries, they'll do everything digital. But when it comes to something to check on their health, little bit somewhere, it's not so nicely married to digital technology. In some way, there is some gap which we have to make it more user-friendly. But the advocacy and the campaign for what all they can do through the digital is so very crucial, because you will be surprised. One villager from Purulia or somewhere West Bengal, which is putting the chat message to me, डॉक्टर आपको लग रहा है कि मेरा ऑक्सीजन सैचुरेशन कम हो रहा है, आज तो 92 बता रहा है. Like this, all she's typing in Hindi and said, because the buzz around COVID, buzz around oxygen saturation, buzz around use of pulse oximeter has been so huge that somewhere in the village she has recognized what it is. So that kind of deep percolation of anemia as an important parameter for the health has not happened, because the point of care devices are there, which is a huge leap from the laboratory assessment. Gone are the days of the blotting paper and all, at least up to the level of hemoglobin, come one prick and then, you get somewhere. But even that one prick, okay, when we go to the school programs for health and hygiene, we have to seek permission from the parents for that one prick, because, everybody is not easily available and everybody, shies away from doing things, etc. So a non-invasive hemoglobinometer, which is like, well into the market, that has to be propagated, validated, evidence published, and we need, because anywhere and everywhere, your health is in your hands is the message that we have to give, because we can come many steps further, but the patient, women, girls, community themselves have to be also responsible for their own health. Okay, everything we cannot expect we have to be fulfilling. So this gap has to be plugged about the advocacy, that they have to be completely aware, and the research part of it. So nicely the data can be captured. And as in, they are checking the temperature in the airport, in the railway station, and use the non-invasive digital hemoglobinometer. Check for all these people everywhere. Each of these touch points you check. They need not come to your clinic at all. So if the data is captured there, we know the trends. All kinds of people traveling by bus or flights or the trains, that's a very good catchment area. People now are not going to movies and restaurants as much because of the COVID restrictions, but anywhere and everywhere, if this is done and the data, so we'll know the real trends of what is happening. Then the question is, what next? You have found out, so what will? People are aware, you have found out, so what next? So the life course approach, which has now been taken in Anemia Mukt Bharat, is an excellent step ahead, because yes, we have the target of pregnancy, we are managing. For what? It's like a pot with a hole, because 30 million deliveries in a year, 30 million newborns going to the infancy, toddler, adolescent, that is 30 million index added every year. So it is a continuum, it's a vicious cycle which is going on and on and on and on, and unless every point is plugged. Having said this much, I would also say that training and capacity building is hugely important, because it's all about behavior change and the mindset. They can do it, but they won't do it. It is like that, because for the public health institution, I think hats off to Archana Mishra, Meena ji and all, who must be, battling with many more challenges than the private. But when we started the Foxy Manyata program, trying to empower the staff in various private nursing homes to do the needful for an antenatal patient, 0% of them were checking height, weight, nutritional status, BMI, and hemoglobin, just noting and forgetting about it. That's all that they were doing. So when we inculcated this, that you must ensure your practice is anemia free, do whatever it takes. You have to check, but you have to be sure. So the nutritional component of everything inclusive of proteins and deworming, it's an excellent 6x6x6 strategy. It has just waiting to be solidly, robustly implemented there. So all of us, whether in private or in public or in rural or in urban, we come together and sing the same song, speak with the same voice, use the synergies and capitalize on the reach of the digital for ART, A-R-T as we call it. A for advocacy, R for research and implementation. We know where the gaps are, who is doing, who is not doing right, and T for training or capacity building, because it has to become a norm. It has to become a way of life for the healthcare providers, each and every Anganwadi or Asha or the staff nurse or frontline healthcare provider or counselor, they should all know A to Z. It is not rocket science. It's so doable, and it is a shame that until now, yes, the right time has to come. COVID has come. Digital India is leaping forward. So let's encash this opportunity. Let's get our act together. And once again, very firmly resolve that India will move in its journey and we will have an Anemia Mukta Bharat. Thank you.
So passionate about the Anemia Mukta Bharat and the hemoglobin testing. Congratulations, Dr. Hema. Really, fantastic to conclude these three sessions. So I think we come to the end of this third
If
session.
I may just add one little sentence, which will probably give a lot of hope to everyone.
Yeah.
During the COVID times, I downloaded an app on my phone, which converted my phone to an pulse oximeter. Right?
Wow.
So if that is possible, then I don't see any problem in point of care devices and measuring non-invasively hemoglobin. It's all about having the right algorithm.
Because where to be, WEAR to be, that is from the Israeli company that, they have just a band. So, the future is there.
No, you can just put your finger on the camera of the phone and it would measure your.
It will give everything.
Right? It's there already.
But the gap is that maybe many are not aware, but some who are aware also will not act upon what they have found. So that gap, we need to just bridge it and see to it that impact is that they have to become anemia free. So each one. Yeah. Thank you.
Yeah.
I think Shiva, we can have one concluding remark from all the speakers before we stop the session.
Yeah. Maybe I'll start with Mr. Arun.
I think I've said my bit that.
Okay. So
I completely agree with Dr. Devakar that advocacy and training are extremely important. There are digital tools to do this very well. And behavioral change must be kind of built into every policy and program that the government does. That is the most significant challenge in any program, is behavior. Thank you.
Dr. Archana, you were concluding one sentence or a statement. I think she has left us. So I'll come to Dr. Hema in the end. Dr. Virender.
Sir, persistence will be the key. लगे रहो वही वाली बात है. असली आवत जाती है सिर पर परत निशान. जितना the effort will do, will see the fruits. Efforts are needed at every level, sir.
Very nice. Very well, sir. Lage raho. That is what it is. So, Dr. Meena.
Yeah, sir. The first important thing is the awareness. I think that's very needed because prevention is better than the cure. Another important thing is the affordable, effective, and efficient and availability of the test. It's also very important. And related to the specification like the e-voucher and other things, that if we give the e-vouchers to particular test, then again it's a big challengers. But I think it's awareness between the community, between the public-private partnership and others thing is very important for the Anemia Mukta Bharat.
Dr. Hema.
I would say let's walk the talk together. That's what it is. And one small point, Siva, about double fortification of salt, which they're toying with that idea, iodine and iron. We have to study the impact of that in at least few districts. And, if that comes into play, I think it may also go a long way in moving the needle forward. So together we can, is what I believe. Namaste.
Thank you. So to summarize this session, I think, it has been a very, very not entertaining. Entertaining is the wrong word, but yes, ultimately we got entertained on the anemia aspect and how to eradicate this, but very educative session that we had we had prominent people in the group. I think the learnings are education, advocacy, awareness, affordability. These are some of the things. And one of the very important aspects that Dr. Hema brought about is the hesitation in using the digital technology. I think we need to overcome that, and then the utilization of non-invasive technologies like the wristbands or like what we use, the pulse oximeters, etc. So for hemoglobin measurement, that is very, very important. I think what I like the best of this thing is the e-voucher program that Dr. Meena was referring to. I think that will be very, very motivating, and I think we need to propagate that very, very effectively. And in terms of the public-private partnerships, Dr. Meena also was referring to already 50% of the private infrastructure under the Pradhan Mantri Yojana is being used. I think this is very heartening to know. I think that 50% should be increased significantly. I think all the programs and awareness that could happen. And I was very, very impressed with the way the governments like in Haryana and Madhya Pradesh, and also in a smaller union territory like Daman Dayu, have been doing and working towards achieving the objective of Anemia Mukt Bharat. I think as Dr. Hema concluded, let us walk the talk. And then as Dr. Virender said, lage raho. I think these are very, very important statements that we can get from this program. I would like to thank the organizers for giving me an opportunity to moderate this session, and it has been very, very educative. Thank you all for participating. Over to Mr. Shankar.
Thank you, Shiva. I think I cannot add more to what you said. So I think it was a very, very, not a entertaining session, but a very healthy dialogue that took place, a real samvad that took place on this particular platform on anemia and the way forward. And my thoughts are this: whatever you say, I think the way forward is digital. It may take time, but probably some small push here and there. And if the key leaders or prominent personalities start coming into the picture, there's a lot like what Dr. Meena said, through folk art and other things, probably we can spread this message across to the rural areas so that India does not have a digital divide. Thank you very much. Thank you very much for this one. And on behalf of Heal Health and Heal Foundation, I thank all the speakers for the session, and special thanks to Dr. Shiva for moderating the session. Thank you.
Thank you very much.
Thank you.
Namaskar.
Namaskar. Namaskar.